is Abigail Torres. I'm 29 years old and I'm a licensed physical therapist at a rehabilitation clinic in Columbus, Ohio. On September 3rd, 2025, I collapsed in the middle of my sister's baby shower. Ovarian torsion, acute, right side. Someone grabbed their phone. My father intercepted it. She's fine, he said. I'm a cardiologist. Stand down. She just needs air. Then he took the phone from the woman's hand and ended the call before it connected. I heard him say it. I was on the floor, conscious enough to hear every word, not conscious enough to hear every word, not conscious enough to speak. My father is Dr. Raymond Torres, attending cardiologist at Ohio Health Riverside Methodist Hospital. He has been practicing medicine for 31 years. He has a waiting list. He has a parking spot with his name on it. He has a daughter who almost died at a baby shower while he stood 4 feet away and told people she was fine. 43 guests were there. 17 heard exactly what he said. I know because 17 of them later wrote it down and signed their names. I woke up the next morning in a hospital room I didn't recognize, with a tube in my arm and a pain in my side that felt like someone had folded my body in half. The surgery had already happened. They'd removed my right ovary. The torsion had been complete. The tissue was necrotic. My college roommate, Becca, was asleep in the chair next to my bed. Not my mother. Not my father. Becca, who had driven 40 minutes from Westerville at 2 in the morning because no one else came. That was the first thing I understood when I woke up. The second thing I understood came 2 days later, when my sister walked in carrying a manila envelope. My sister Danielle. The one whose baby shower it was. The one who'd always been the good one. The easy one, the daughter my parents talked about at dinner parties. She set the envelope on my lap. Her hands were shaking. I found something, she said. I'm sorry it took me this long. I need to take you back 2 years first. Because what happened at that baby shower didn't start at the baby shower. It started in August 2023, when I first felt the pain. It was a dull ache at first. Right side low. I'd been on my feet for 10-hour shifts at the clinic, managing post-surgical rehab patients, so I assumed it was muscular. Occupational hazard. I'm a physical therapist. I know bodies. I know how they compensate, how they hold tension, how overuse presents in soft tissue. I diagnosed myself as someone who stood too long on hard floors and went home and stretched. The ache didn't go away. By October 2023, it had graduated into something sharper. Not constant, but episodic. It came and went, sometimes lasting 20 minutes, sometimes an hour. I'd feel it during exercise. Sometimes at rest, sometimes in the middle of a patient session, when I'd have to pause and breathe through it and pretend I was fine. I called my father on October 14th, 2023. I know the date because I saved the call log. I started logging our calls the second time, but I'm getting ahead of myself. Dad, I said, I've been having this pain on my right side for 2 months. Low, kind of deep, it's getting worse. What do you think? His response was immediate and certain. The way his responses always were. Muscular, probably. You're on your feet all day. You've always had tight hip flexors. Get a foam roller. Take some Advil. He's a cardiologist. His expertise isn't gynecology or general medicine, but he'd been my informal doctor my entire life. He's the one who told me my childhood stomachaches were anxiety. He's the one who decided my adolescent migraines were dehydration. He's the one who, when I was 22 and mentioned that my periods had become agonizing, said that some women just have harder cycles than others and I should try evening primrose oil. I trusted him because he was my father and he was a doctor, and in our family those two facts combined into something that felt like gospel. November 2023, the pain spread. Not dramatically, not in a way I could point to and say, here, this is new. It just expanded slightly, a wider radius, a heavier quality. I called him again. He said the same thing, musculoskeletal, could be a hip labrum issue. You should get a sports massage. I got the massage. It didn't help. December 2023. I made an appointment with my own primary care doctor. I want to be honest about this because people are going to ask why I didn't do it sooner, and the answer is complicated, and I want to explain it correctly. When your father is a physician and he has told you your entire life that your body's signals are overreactions, you start to build a very specific relationship with your own pain. You learn to discount it before it leaves your mouth. You practice a kind of preemptive dismissal where you run every symptom through the filter of what he would say before you decide whether it's real enough to act on. It's not weakness, it's conditioning. It takes years to understand that the voice telling you you're being dramatic isn't your own. My primary care doctor, Dr. Amara Osei, ordered a pelvic ultrasound. Simple. Standard. The kind of test my father could have suggested 10 weeks earlier and didn't. The ultrasound found a cyst on my right ovary, 4.2 centimeters, not immediately dangerous but not nothing. Dr. Arai, Osei referred me to a gynecologist, Dr. Patricia Huang, who I saw in January 2024. Dr. Huang explained that the cyst was likely functional, that many resolve on their own, but given my pain history, we should monitor it every 6 to 8 weeks. She also said something I wrote down in my phone immediately after the appointment. She said, with a cyst this size and this location, there is some risk of torsion. Torsion means the ovary twists on its own blood supply. It is a surgical emergency. If you ever feel sudden, severe pain on that side, you go to the ER. You don't wait, you don't call anyone. You go directly. I called my father that night and told him about the cyst. I told him what Dr. Hong said about monitoring it. I told him about the torsion risk. He was quiet for a moment. Then he said, ovarian cysts are extremely common, Abigail. The vast majority of women with cysts never experience torsion. Dr. Huang is doing her job by telling you the worst case scenario, but you shouldn't fixate on it. You're a healthy 27-year-old. Stop catastrophizing. I want you to hold that word, catastrophizing. I heard it so many times in the next 18 months that it stopped sounding like a word. It became a reflex. A door closing. February 2024. Follow-up ultrasound. The cyst had grown to 5.8 centimeters. Dr. Dan Wang said we were approaching the threshold where she'd recommend surgical removal. She scheduled another ultrasound for April and said if it continued to grow, we'd talk about an outpatient procedure. I called my father. He said, second opinions exist for a reason. Not every gynecologist needs to operate on every cyst they find. Some of them are surgery happy. I'd wait and see what happens. I didn't know whether to trust my doctor or my father. I want you to sit with how that sentence feels, because that confusion was where I lived for a year and a half. April's 2024 ultrasound. The cyst was the same size, no growth. Dr. Hung said we'd continue monitoring. I exhaled for the first time in months. That summer, I started to feel better. The pain was still there, still episodic, but less frequent. I told myself this was good. I told myself my father had been right, that the worst-case scenario wasn't coming for me. My sister Danielle got pregnant in June 2024. The family energy shifted the way it always did when Danielle had good news. She's 3 years older than me, a hospital administrator at Mount Carmel, married to a man named Grant who my parents adore. When Danielle's name comes up at family dinner, my father leans forward slightly. When my name comes up, he maintains the same posture he uses for passing the bread. I've been watching that lean my whole life. August 2024. Follow-up ultrasound. The cyst had grown again. 6.7 centimeters. Dr. Huang sat across from me and said, Abigail, I think we should schedule the laparoscopy. The risk of torsion at this size is meaningful. I don't want to wait until there's an emergency. I said I'd think about it, which meant I was going to call my father. He picked up on the second ring. I told him the new measurement. I told him what Dr. Hong recommended. He was quiet. Then, is Dr. Hong affiliated with any surgical center? Because there's a financial incentive structure you might not be aware of. Sometimes recommendations that look medical are actually, Dad, I said, she's worried about torsion. Torsion is rare, Abigail. You've been monitoring this for 8 months and nothing catastrophic has happened. I get a second opinion before letting someone put a camera inside you. I did not schedule the laparoscopy. I told Dr. Hung I wanted to wait. She documented my refusal. She asked me to come back in 6 weeks. She said, Abigail, please don't wait too long. I was still calling my father. I was still running my symptoms through his filter. I was still, at 28 years old, asking my father's permission to trust my own doctor. October 2024. The pain was worse. I started timing the episodes on my phone. The longest one lasted 47 minutes. I was at the clinic in the middle of documenting a patient session when it hit me, and I had to sit in my car in the parking garage for almost an hour before I could drive home. I called my father from the parking garage. He said, "You might be experiencing referred pain from a hip issue. Have you tried a new pair of orthotics?" November 2024. I went back to Dr. Hunk. She measured the cyst at 7.1 centimeters, and her face did something I hadn't seen it do before. She stopped writing and looked at me directly. "Abigail," she said, "I need you to hear me clearly. This cyst needs to come out. The longer we wait, the higher the risk. I'm asking you to let me schedule the surgery." I said yes. Finally, I said yes. The surgery was scheduled for October 15th. In the meantime, Dr. Hong gave me a list of warning signs: sudden severe pain, nausea and vomiting with pain, inability to stand upright. Any of those, she said, is an ER visit. No exceptions. I called my father and told him I'd scheduled the laparoscopy. He said, "I suppose if it makes you feel better." That was the entirety of his response. December 2024. January 2025. I was managing. The pain was still there, but I was 3 months from surgery and I had a plan, and I felt, for the first time, like I was taking care of myself on my own terms. February 2025. The surgery was cancelled, not for a medical reason, because my clinic moved my schedule around after we lost 2 therapists in January, and I was suddenly covering extra patients, and I convinced myself I could push the surgery to spring when things settled down. My father, when I mentioned this, said that seemed reasonable. March 2025. Dr. Dumaithrin, Wang sent me a message through the patient portal. "I'm concerned you rescheduled. When are you coming back in?" I rescheduled for June. June 2025. I came in. The cyst was 7.9 centimeters. Dr. Wang looked at the screen and then looked at me and said, "We are scheduling this for the first available date. I am not letting you leave without a date." August 7th, 2025. That was the date. 6 weeks away. On September 3 to 25, Danielle's baby shower was held at our parents' home in Upper Arlington. 43 guests. Catered. Danielle was 32 weeks pregnant and glowing in a way that made everyone in the room feel the warmth of her. My mother had spent 3 weeks planning the event. There were flower arrangements on every surface. There was a grazing table with cheeses from Whole Foods. I woke up that morning with a 4 out of 10 ache. Not unusual. I took ibuprofen and told myself to get through the afternoon. I got there at 11. I helped set up. I arranged gift bags. I stood for most of the first 2 hours because there weren't enough chairs for the setup my mother had designed, and I didn't want to make it awkward by rearranging things. At 1:17 in the afternoon, the pain changed. I know the time because I looked at my phone exactly when it started, some reflex from 18 months of tracking. One moment I was standing near the kitchen island talking to my cousin. The next moment I felt something in my right side that I had never felt before. Not the dull ache, not the episodic sharpness. Something that felt like a fist closing around an organ and twisting. I remember thinking very clearly, this is it. This is what Dr. Hong described. I also remembered thinking, but Dad said torsion is rare. Those two thoughts existed in my brain simultaneously for approximately 4 seconds. Then my legs stopped holding me. I went down next to the kitchen island. I heard someone scream. I heard glasses breaking. I heard my name from multiple directions. I couldn't respond because breathing required everything I had. A woman named Courtney, Danielle's co-worker, was the first one to get to me. She had her phone out. She was saying, "I'm calling 911. I'm calling right now. Hold on." My father crossed the room. I heard his footsteps. I heard him say, "Let me handle this." I heard the specific tone in his voice that has always meant the conversation is over. The one that's worked in this family for 31 years. Courtney's voice, "She's on the floor, she can't stand up." My father, "I'm a physician, I'm her father. I'm telling you, this is a vasovagal response. It looks alarming, but it's not dangerous. She doesn't need an ambulance." Courtney, "But she." My father, "I will take responsibility, do not call." 17 people heard this, I know, because Danielle later contacted every guest and asked. 17 people signed statements saying they heard a physician instruct someone not to call 911. I was on the floor. I was in the worst pain of my life. I could not get a full breath. I was thinking with the strange clarity that comes with crisis that my right ovary was dying, that the blood supply had been cut off, that every minute mattered. I tried to say call 911. What came out was not a sentence. My father knelt beside me. He took my wrist. He was checking my pulse with his fingers the way he has done since I was a child. Clinical, certain. His voice was calm. You're okay, Abigail. Slow your breathing. This is a panic response. You're okay. I was not okay. Across the room near the French doors, I saw Becca. We've been friends since freshman year at Ohio State. She's not in medicine. She's a graphic designer. She was watching me with an expression that I recognized even from the floor, even through the pain, because I'd seen it before. It was the look of someone who doesn't know the rules of the room, but knows something is wrong. She moved toward me. My father said, "We have it handled." Becca said, "She looks like she's in real pain." My father said, "I appreciate your concern. I'm a cardiologist. I'm managing this." Becca took out her phone. She went to the back hallway near the bathroom. My father didn't see her go. I watched her disappear around the corner, and I felt something that I can only describe as hope, which is a strange thing to feel when you are lying on a catered baby shower floor with your ovary dying. At 1:26 p.m., Becca called 911 from the hallway. She told them a 29-year-old woman was on the floor in severe abdominal pain, unable to stand, known ovarian cyst, possible torsion. She gave the address. She stayed on the line. 9 minutes after I collapsed, the ambulance arrived. 9 minutes. In ovarian torsion, every minute without blood flow increases the chance of losing the ovary. At 9 minutes, for me, it was already too late for the ovary. The surgeon would later tell me that the tissue had been compromised for longer than that. The pre-existing cyst, the delay, the combination, my right ovary was removed that evening at 7:43 p.m. But I was alive. My father met the paramedics at the door. I heard him say, "She has a history of anxiety and somatic complaints. This is likely a panic attack with hyperventilation." One of the paramedics, a young woman whose name I later learned was Teresa, looked at him and said, "Sir, can you step back, please?" Then she looked at me. "Can you tell me where it hurts?" I pointed to my right side. My hand was shaking. On a scale of 1 to 10. 10, I said. First word I'd managed in 11 minutes. They loaded me at 1:2029 p.m. My father was talking to the other paramedic in the driveway. I heard the words stable and unnecessary as the doors closed. I coded once in the ER when my blood pressure dropped during pre-op assessment. They stabilized me in 6 minutes. I didn't know any of this until the next morning, when the nurse, whose name was Gabrielle, told me what had happened while I was under anesthesia. Danielle was sitting beside my bed when I woke up. Not in the chair she'd pulled close to the railing, actually sitting on the side of the bed in a way that can't be comfortable when you're 32 weeks pregnant, one hand over mine. She looked exhausted in a way that had nothing to do with the pregnancy. "Hi," I said. She started crying. "I didn't know," she said, "about the cyst, about how bad it was. You didn't tell me." "I didn't want to take away from the pregnancy stuff," I said. She cried harder. "I had a surgeon come in at 10 that morning. Dr. Cynthia Park." She explained that the torsion had been complete, that the ovary had undergone significant ischemia, that removal was the only option. She said my fertility was not necessarily affected, that one ovary is sufficient for conception, but that I should speak with a reproductive endocrinologist at some point about monitoring. Then she said something I wasn't expecting. "Abigail, your gynecologist, Dr. Wang, flagged the surgery as urgent 6 weeks ago. She scheduled you for August 7th. What happened to that appointment?" "I rescheduled it," I said. "Can I ask why?" I didn't answer right away. Because the answer was, because my father told me, through 18 months of smaller comments, that the risks were overstated, and that I was catastrophizing, and that my doctor was being aggressive, and that I should wait and see. "Family advice," I finally said. "Dr. Nather." Park's face was careful and professional in the way that medical faces get when they want to say more than they should. "Going forward," she said, "please follow your gynecologist's recommendations." She was right. She's been right. Danielle came back that afternoon. She was carrying something, an envelope, the kind that used to hold paper files. The clasped kind, bent at the corners like it had been in a drawer for a while. I went through his office, she said. After they brought you in, I drove home and I went through his office. I don't know what I was looking for. I was so angry and I needed to do something. She put the envelope on my lap. I'm sorry, she said. I'm sorry I didn't know sooner. I opened it that night after Danielle had gone home to sleep and Becca had fallen asleep in the chair. The envelope was not labeled. Inside there were papers, folded in thirds, the way you fold something to put in a business envelope. The first document was a form. I recognized the letterhead immediately. Ohio State University Wexner Medical Center, Department of Continuing Medical Education. It was a CE credit form standard, the kind physicians complete to maintain their license. Dated March 2024. Stapled to it was a note in my father's handwriting. The handwriting I've known my whole life. The note said, R, confirmed March 14. Keep separate. I didn't know what R confirmed meant yet. I kept reading. The second document was an email printed out. From an address I didn't recognize, a Gmail account with a string of numbers, to my father's personal email. Dated February 28, 2024. Ray, the email said, here's the situation. She's been to see Dr. Huang twice now. Huang's pushing for surgery. I think she'll go through with it eventually if no one talks her out of it. You've been handling it well. Keep it up, C. I didn't know who C was yet. The third document stopped me completely. It was a letter. My father's letterhead. Raymond Torres, MD, FAC, attending cardiologist, Ohio Health, Riverside Methodist Hospital. The letter was addressed to my landlord. My landlord in 2022, when I was looking for an apartment in Columbus after I'd been offered the position at the clinic and was trying to move from Cincinnati. I had asked my father to write a reference letter. He'd said, of course. He'd said he was proud of me. The letter he actually wrote said this: to whom it may concern, I am writing on behalf of my daughter, Abigail Torres, who has applied to rent at your property. While Abigail is employed and maintains her financial obligations, I feel obligated to mention that she has a history of emotional instability that has affected her professional and personal relationships. She has difficulty managing stress and has, on multiple occasions, made impulsive decisions that have required family intervention. I would recommend a shorter lease term to allow both parties to assess the situation before committing to a longer arrangement. Please contact me directly with any concerns. I read it twice. The apartment had gone to another applicant. My father had told me the landlord chose someone with a longer rental history. I had believed him. I kept going. There were 6 more documents. A reference letter to my clinic, written when I applied for my current position, with a final paragraph noting that I occasionally struggle with professional boundaries and may require additional supervision during high-stress periods. I had not gotten the full-time position I applied for. I had been offered a part-time contract that was later converted to full-time after my supervisor said she'd seen enough to be confident I was a good fit. I had attributed this to a tough job market. A note from my father to someone named Conrad. I found out later that Conrad is my father's brother, my uncle, who serves on the board of a professional women's organization I'd applied to for a career development grant in 2023. The grant was $8,000. It would have paid for an advanced certification program I'd wanted to do for years. I was rejected. The note said, Conrad, I'd recommend not moving forward with Abigail's application this cycle. She's going through some personal instability. Let's revisit next year. Next year never came up again. And then, at the bottom of the pile, a document that was not a letter or an email. It was a printout from my patient portal. My Ohio Health patient chart, the one my primary care physician uses, the one that tracks my medical history. In 2021, my father had been listed as an emergency contact. In 2022, the portal had a brief period where emergency contacts had limited view access to non-sensitive patient information before the privacy settings were updated. During that window, my father had accessed my chart. The printout showed the access log. He'd gone in 7 times between January and March 2022. He'd seen my documented visits. He'd seen my Dr. Hong referral from 2023 before I knew about it, because that referral had been generated from a portal message I'd sent Dr. Osei. He knew before I told him. Every time I called him to share a new development, he already knew. He wasn't advising me from a position of neutral medical expertise. He was advising me from a position of having already seen the file. I sat in my hospital bed at 2 to 17 in the morning, and I put the pieces together. My father had spent years engineering my professional and personal setbacks. He'd written letters that closed doors I didn't know were open. He'd accessed my medical records through a privacy gap and used that information to stay ahead of my treatment decisions. He'd watched me defer to his authority for 18 months about a cyst that his own field had nothing to do with, and he had deliberately reinforced that deference because the alternative was me becoming someone who didn't need his permission anymore. And at the baby shower, when I was on the floor with a dying ovary, he did not call for help. He managed the situation the way he'd been managing me for years. Clean, professional, certain, and wrong. I called Danielle at 2:24 in the morning. She answered in 2 rings. She'd been awake. "I need a lawyer," I said. "And I need you to not tell Mom yet." "Okay," she said. There was no hesitation. "Okay, tell me what you found." The next morning, a woman named Iris Castellano walked into my hospital room. She'd been a patient, rights and medical malpractice attorney in Columbus for 14 years. Danielle had called her at 7 in the morning. She had 91% verdict success rate on cases she took to trial. She sat in the chair Becca had been sleeping in, and she looked at the envelope on my tray table and she said, "Walk me through it." I did. All of it. The calls, the letters, the portal access log, the email from C, the 9 minutes. When I finished, she said, "The portal access is significant, depending on how that access was granted, and whether he used that information to influence your care decisions. That could constitute a HIPAA violation in addition to the malpractice claim." "Can I file a complaint with the medical board?" I asked. "You can," she said. "I'd recommend doing it. The board and the civil case can run simultaneously. One does not preclude the other." "What about the letters?" She thought for a moment. "The landlord letter, the clinic letter, the grant note, individually. Each one might be hard to characterize as more than poor judgment. Together with the pattern, with the medical chart access, with what happened at the baby shower, it starts to look like a sustained effort to limit your independence." She was quiet for a second. Then, the email from C, who is C. I found out 3 days later. Danielle figured it out. She went through my father's contacts, through the email he'd printed, through the return address. C was Conrad, my uncle. The same uncle who'd been on the board of the grant organization. The same uncle who had written back, according to a separate, printed email I'd missed the first night, saying, "Understood, handled." My uncle and my father had been coordinating. I don't know for how long. I don't know how many opportunities were closed before I even knew they existed. When Danielle found a second email, she called me. She said, "I'm going to be sick. And then I'm writing my statement tonight." My father called on September 8th. 5 days after the baby shower. First contact. He said he'd heard I was upset and he hoped I understood that he had acted in my best interest at the shower, that he was a physician and his assessment had been based on experience, and that the outcome, while unfortunate, was not foreseeable. He did not ask how I was feeling. He did not say he was sorry I lost my ovary. He did not say he was glad I was alive. I let the voicemail play to the end. Then I saved it. Iris would want it. On September 15th, Iris filed a formal complaint with the State Medical Board of Ohio. Case number SMB 20-57774. The complaint alleged 3 things: obstruction of emergency medical care, conflict of interest in providing informal medical advice to a family member for whom he had accessed protected health information, and failure of duty of care. 17 witness statements were attached. Becca's 911 call recording was attached. My medical records from Dr. Hong's office were attached, showing 18 months of escalating risk and a surgery recommendation that had been delayed. Iris also filed a separate complaint with the Department of Health and Human Services Office for Civil Rights regarding the HIPAA violation. That investigation was opened within 10 days. Danielle wrote her witness statement on September 10th. She sent it to me before she sent it to Iris. She read it to me over the phone. Her voice was steady the entire time except at the end, where she said, "I am submitting this statement because my sister lost an organ that did not have to be lost, and because I spent 32 years believing my father was the most trustworthy person I knew, and I was wrong about both things. She submitted it. Then she called Mom. I don't know everything that was said on that call. My mother called me 2 hours later. She was crying in the way that is not about sadness, but about something cracking open. Why didn't you tell me about the cyst? She said. Because Dad told me it wasn't serious, I said, and I believed him. She was quiet for a very long time. He had no business accessing your records, she said finally. No, I said. He didn't. And the letters? Yes. She said, I didn't. And the letters? Yes. She said, I didn't know about the letters. I believe her. I've thought about whether I believe her, and I do. She came to my apartment on September 17th. She brought soup she made herself, chicken and rice, the kind she made when I was sick as a kid. She sat at my kitchen table and I showed her the documents, and she read them one by one without saying anything. When she finished, she put them back in the envelope carefully, the way you'd handle something fragile. And she said, What do you need from me? I said a statement, if you're willing. She wrote one. My father's preliminary hearing with the State Medical Board of Ohio was held on November 12th, 2025. Iris and I were there. My father came with 2 attorneys. He looked smaller than I remembered, which I know is not possible, but is still true. The board chair opened by saying that the hearing concerned 2 distinct issues: obstruction of emergency care at a private residence on September 3rd, and the unauthorized use of protected patient information to influence medical decision-making. My father sat very still. Becca testified. She had printed her call log time-stamped. She had her 9-1 recording, which the board played in full. Her voice on the recording was calm. Clear. 29-year-old woman. Possible ovarian torsion. Known cyst. Unable to stand. We need help now. In the background of the recording, you could hear my father's voice saying that the situation was being handled. The board member who asked Becca questions was Dr. Anita Ramsey. She asked, Why did you make the call without telling the family? Becca said, Because I've known Abigail for 11 years. I know what she looks like when she's scared. She was terrified. And someone with authority was saying not to help her. I didn't have medical training and I didn't need it. I just needed to be someone who made the call. Dr. Ramsey said, Thank you. Dr. Hong testified via video. She presented the full chart history. Cyst documented at first visit. Growth trajectory documented. Torsion risk documented. Surgery recommended. Surgery recommended. Surgery lay documented. She was on screen for 26 minutes and she was precise and factual, and twice the board chair asked her to slow down so the stenographer could keep up. She said one thing that I've kept with me. She said, In my clinical opinion, the delay in surgical intervention was directly influenced by repeated discouragement from a family member who presented himself as a medical authority. I watched a patient discount my recommendation 9 times over 14 months. That does not happen in a vacuum. My father's attorney argued that the informal advice given to a family member was not subject to the same standard of care as formal physician-patient relationships. The board member who responded to this was Dr. Siebend, James Whitfield, who had been on the board for 9 years. He said, Cancer, when a physician uses their credentials to dissuade someone from following a treating physician's recommendation, and then uses those same credentials to obstruct emergency medical response, the board will determine whether a standard of care applies. That's what we're here to do. I testified for 41 minutes. I brought the envelope. I brought the letters. I brought the portal access printout with the 7 access dates. I read the landlord letter aloud because Iris said it was important for the board to hear it in my voice. The room was very quiet while I read it. When I finished, the board chair, Dr. Eleanor Nash, asked me one question. At any point during those 18 months, did your father encourage you to follow Dr. Hong's recommendations? No, I said. Thank you, Miss Torres. The board deliberated for 59 minutes. They came back at 5:31 p.m. Dr. Nash read the decision. The board finds sufficient cause to issue an immediate interim suspension of the medical license of Raymond Torres, MD, pending full investigation into obstruction of emergency medical care, unauthorized use of protected patient information, and pattern of conduct constituting professional misconduct. The suspension is effective immediately. The vote was 10-2. My father looked at the table when she read it. He did not look at me. Outside the hearing room, Iris said, "The civil case is next. November was phase 1. I said, "I know." She said, "How are you doing?" I said, "I don't know yet." Within 3 weeks of the suspension, Ohio Health put my father on administrative leave. Their statement said they took the board's findings seriously and were conducting an internal review. This statement was 4 sentences. It took them 11 days to issue it. The HIPAA investigation is ongoing. HHSOCR does not move quickly, Iris warned me. Could be 18 months before a finding. Could be longer. On November 20th, 2 women contacted Iris through her firm's intake form. Both had been patients of my father. Both described having pain conditions minimized or dismissed during consultations where he had overstepped into non-cardiac advice. One was a 34-year-old woman who'd come in for a cardiac screening and mentioned in passing that she had pelvic pain. My father had told her it was likely IBS and she should cut out caffeine. She was later diagnosed with stage 2 endometriosis. By later, I mean 14 months later, after she'd lost a fallopian tube. The other was a 41-year-old woman who had a similar story with different specifics. She had been his patient for 7 years. I met the first woman, whose name is Alicia, for coffee on November 28th at a coffee shop off High Street. She walked in and saw me and immediately said, "You're why I found the courage to call." I didn't know what to say to that. I'm still not sure I do. My mother and father are separated. She stayed in the house. He moved to his brother's apartment. My uncle, the same uncle who sent the email, which adds a complication to that branch of the family that I'm not going to untangle in this telling. My mother has started therapy. She calls me on Sundays. We talk about things we've never talked about. It's new and uncomfortable, and I think it's going to be okay. Danielle's daughter was born on October 31st. She weighs 7 pounds, 4 ounces. Her name is June. I was in the waiting room when she arrived. Daniela's husband, Grant, brought her out in a blanket that had little animals on it and put her in my arms, and she smelled like something I don't have the words for. I cried in a way that surprised me. Not about the loss, exactly. Or not only about it, about the fact that I was there, that I was alive to hold her, that Becca had gone to a hallway and made a phone call and I was alive. I went back to work on October 6th, part-time at first. My supervisor, who knew pieces of what had happened, didn't ask questions. She just adjusted my schedule and put a new ergonomic mat at my workstation and said, "We're glad to have you back." My first week back, I had a patient, a 38-year-old woman, post-hip replacement, 3 weeks out, who mentioned at the end of our session that she'd been having some lower abdominal pain her doctor had attributed to muscle tension from compensating with her gait. She said it almost as an aside, a footnote. I stopped writing in her chart. I said, "How long have you had this pain?" She said, "About 4 months." I said, "Is it on one side?" She said, "Right side, mostly." I said, "I want you to call your gynecologist today. Not your orthopedic surgeon, your gynecologist today. Not your orthopedic surgeon. Tell them exactly what you told me. If they can't see you this week, go to your primary care. Ask for a pelvic ultrasound." She looked at me like I'd switched languages. I said, "I know it might be nothing, but 4 months is long enough to check. You deserve to know what's happening in your body." She came back the following week and told me she'd gotten the ultracyst. There was a cyst. Small, not urgent, but there. Her gynecologist was going to monitor it. She said, "How did you know to ask?" I said, "Because someone should have asked me sooner. People asked me if I've forgiven my father. I haven't. I'm not sure forgiveness is the right frame yet. What I've done is simpler and harder. I've stopped asking for his permission. I've stopped running my symptoms through his filter. I've stopped waiting for him to tell me my pain is real before I allow myself to act on it. I have 1 ovary. I have a case number. I have a sister who chose truth over silence when it cost her something. I have a friend who walked to a hallway and made a phone call that saved my life. I have a patient who got an ultrasound because I asked the right question. I have myself back. And that for now is more than enough. Your pain is real, even when the person with the most authority in the room says it isn't. Your body's signals are valid, even when the voice you've trusted your whole life tells you to ignore them. And sometimes the most important call that gets made on your behalf is made by someone with no medical training at all, standing in a hallway doing the one thing that nobody else in the room had the courage to do. My name is Abigail Torres. I'm 29 years old. I'm a physical therapist in Columbus, Ohio, and I'm still here. I've thought a lot about what actually happened over those 18 months, not the medical part. I understand the medical part now with a clarity that still makes me catch my breath sometimes. I mean the other part. The part where I, a licensed physical therapist who spends her days reading bodies and identifying when something is wrong, handed that knowledge over to someone else because his title felt bigger than my instincts. That's the thing nobody warns you about when it comes to someone like my father. It's not that he was loud or cruel in the obvious ways, he was certain. And certainty, when it comes from someone who has held authority over you since you were born, doesn't sound like control. It sounds like care. It sounds like care. It sounds like wisdom. It sounds like the voice in your head that already knows the answer before you finish asking the question. What I've had to reckon with, and I'm still doing it, I'm not going to pretend I figured it out, is that the version of me who kept calling him wasn't weak. She was conditioned. There's a difference, and it matters. Every time I called and he said catastrophizing, he wasn't just dismissing a symptom. He was reinforcing a years-long pattern that taught me my own judgment was the thing least worth trusting. That's not something that happens once. That's something that gets built, call by call, letter by letter, small closed door by small closed door. What saved my life was not a dramatic reversal. It was Becca walking to a hallway. That's it. No medical training, no authority, just someone who knew me well enough to look at my face and understand that the person with the credentials was wrong, and that making the call mattered more than making a scene. I think about Danielle a lot too. She spent 32 years being the good daughter, the easy one, the one my father leaned toward at dinner. She could have stayed there. It would have been so much simpler. Instead, she drove home from that hospital, went into his office, and started looking. I don't know exactly what moved her to do it. I've asked. She says she doesn't fully know either. She says she just couldn't stop being angry, and anger made her move. That's what I want to say about all of it, if there's something to take from this. The people who helped me. Becca, Danielle, Dr. Bach, Huang, Iris, none of them did anything extraordinary in the moment. They just refused to override what they could plainly see in front of them. Becca saw a woman in pain. Danielle saw a pattern that couldn't be coincidence. Dr. Hong saw a chart that told one story while my father told another. Iris saw documents that, laid side by side, meant something undeniable. Trusting what you can see is not a small thing. It sounds simple, but it costs something, especially when the person on the other side has more authority, more credentials, more certainty in their voice. It costs you the comfort of deferring. It costs you the relationship sometimes. It cost Danielle something with our father that neither of us thinks is coming back. But here's what I know now, 9 months out with one ovary and a case number and a patient who got an ultrasound because I asked her the right question. When you have a body that is telling you something is wrong, that signal is yours. It belongs to you. No one. Not a cardiologist. Not a parent. Not the most certain voice in the room has the right to overwrite it. And the moment you stop waiting for someone else to confirm that your pain is real enough to act on, something shifts. Not all at once, but it shifts. My name is Abigail Torres. I almost didn't make it to 30, and I will never again let someone else decide what my body is allowed to feel.